when I see the name doctor's name board outside, I will be getting totally confused about it.
Doctor name boards as in what exactly confuses you? Their qualification,
Yeah,
whatever they would have written?
qualification.
Okay. As in many times they would have written MBBS, MD, MS.
MBBS, MD, TCH and
Okay.
all they will be writing
See,
words.
this is a little elaborate topic. I'll try to simplify as much as possible. And first of all, the word doctor is awarded to, broadly we can classify to two category of people. First category is the one who have studied and understood human or animal body, about the diseases, and have studied and learned how to treat them or cure them. All these people who have studied either human diseases or animal diseases and learned how to cure them, once they complete their course, they get a degree and they get this title doctor. There is another sector who, apart from this, who have lot of knowledge in a very specialized topic like a PhD degree. They awarded doctorate degree. So this is a doctorate, and certain people are awarded by certain universities. For example, Dr. Rajkumar, Dr. Puneet Rajkumar, as an honorary for their contribution to arts or culture. Certain universities award them. There are various systems of medicine. When we go back to the past, in different countries, centuries ago, people have made multiple attempts to understand the human body, to explain how it functions by various ways. Which originated from the Indian subcontinent is the Ayurveda system of medicine. Allopathic system of medicine, the other one, what we call the Western system of medicine, which major contribution came from the United States and the UK, the allopathic system of medicine, and the other one is the popular homeopathic system of medicine, where origin is mainly from Germany. And there are other systems of medicine like Siddhi, naturopathy, Unani is from the Middle East. These are the other systems of medicine. Everybody tried to, they put down certain theories or ways of understanding the human body and ways of treating diseases, and everybody have been successful in their own way, and everybody has certain limitations in their own way. I am an allopathic practitioner, so I will be speaking more about the allopathic system. I have very little knowledge about the other systems of medicine. So coming to allopathy, to start, first of all, when you see a name board, if you see the word doctor next to a person's name, for example myself, Dr. Jaidev, you just read below. If the doctor is from allopathic system of medicine, he would have definitely mentioned the word MBBS. If the word MBBS is there, he is definitely an allopathic practitioner. If other words like BAMS, it is Bachelor of Ayurvedic Medical Sciences, BAMS, or if it is BHMS, they are Bachelor of Homeopathic Medical Science, BUMS, Bachelor of Unani System. So by this you will come to know whether your practitioner is allopathic, Ayurvedic, homeopathic. Dental, they would have written BDS, Bachelor of Dental Surgery, BPT, Bachelor of Physiotherapy. They are doctors. They would have understood the human body, the musculoskeletal system, and learned how to treat or cure musculoskeletal disorders. So this is about the undergraduate. Hope this category, these, if I have to put it in the form of a pyramid, the education pyramid of degrees, a doctor earns, the undergraduate degree forms the base brick. The next comes once they complete their undergraduate program. If they wish, they can pursue their post-graduation program. In the allopathic system of medicine, this would be either called an MD or an MS. So if a doctor has written after his MBBS degree as an MD or an MS, that means he has done his post-graduation. He has specialized in among the entire human body in one organ or one organ system. He has specialized. So now let us try to understand the difference between MD and MS. Usually when we use the word MS, here M is Master of Surgery. these are the doctors who offer treatment, who offer surgical treatment, who are qualified to offer surgical treatment. That means they get a license to operate, put an incision on the human body, to cut open and to treat diseases with a knife, surgical. The commonly encountered MS degrees are MS in general surgery. Most of the times operate the abdomen or hands, limbs, these regions. MS general surgery or MS ENT, they surgically try to treat diseases of the ear, nose and throat. MS in ophthalmology, surgeries of the eye. These doctors, they offer medical treatment also. Along with that, they have an extra eligibility or extra knowledge to also offer surgical line of treatment. When it comes to MD, these are doctors who are exclusively specialized in offering non-surgical treatment. They try to treat illnesses with medications. There are certain intricacies in this which will come to later, how there are certain exceptions, how they do interventions. That will keep it for a separate video, but if I start talking on exceptions, it will become very confusing. So overall you can remember as MD treat diseases exclusively through medical ways, non-surgical ways. MS people, along with medical, they have the eligibility to treat surgically. So this forms the second layer of the pyramid, and not just in allopathic, in Ayurvedic or in physiotherapy, after doing their BPT, if they would have written MPT, that means they have done masters, they have done master in physiotherapy. For example, they would have done masters in neurophysiotherapy, and even in Ayurveda they would have done their masters, they would have mentioned masters. So this forms the second layer of the pyramid. Usually the undergraduate degree, what I mentioned, usually it will be on an average 5 to 6 years. The postgraduate degrees are on an average 3 years, MD and MS. A small add-on to this, there are certain diploma degrees, post-graduation diploma degrees. It's for a duration of 2 years. They would have, for this diploma degree, they would have mentioned as DCH, Diploma in Child Health. It is a 2-year degree, it is a postgraduate degree. Or DLO, Diploma in Laryngotology, Diploma in Diseases of the Ear and the Throat. DGO, Diploma in Gynecological and Obstetric Diseases. So now coming back to the topic of super speciality. After MD and MS, doctor can super specialize. These super specialty degrees are given the names DM and MCH. So a doctor who wants to super specialize if he is background from a surgical background, if he has done his MS and he wants to super specialize through a 3-year degree, it is known as he will earn a MCH super specialty degree. The commonly encountered super specialty degrees are MCH in neurosurgery, that means MCH in brain and spine surgeries, MCH in urology, it is diseases of the kidney, bladder, surgical treatment, or MCH in gastrointestinal surgery, GI surgery. Similarly, a doctor who has done his post-graduation degree in MD wants to super specialize in a certain more narrow field, he will be awarded after 3 years of studies, he will be awarded a degree known as DM. After MD, it is a DM. For the commonly encountered DM degrees are DM in cardiology, DM in nephrology, who treat diseases of the kidneys most medically. Yeah, people who have done MD anesthesia can pursue super speciality in just anesthesia to the brain and spine problems, surgeries, DM neuroanesthesia. So these doctors, after their MBBS and MD or MS, they would have a degree either an MCH or a DM based on their post graduation. After this, these are the major degrees. After this, if a doctor wants to even study further certain diseases or specialize in certain specific surgeries, then there are fellowships awarded. Fellowships usually will be of shorter duration, anywhere ranging from 3 months, on an average 3 months, to say 2 years. For example, I can tell you fellowships in neurosurgery. If somebody after doing neurosurgery wants to even super specialize in just treating brain and spine problems in children, so he can do a fellowship in pediatric neurosurgery. There are colleges or medical institutes in India and abroad who will award. You can undergo training and they will award. They would have written after their MCH, they would have written fellowship in pediatric surgery. Or somebody wants to more do a fellowship or even understand about brain tumors, certain brain tumors, they would have written fellowship in neuro-oncology. So these are the fellowship. If they would have mentioned fellowship, you would have seen words like MRCP, MRCS. MRCS, MRCPs are, MRCP stands for Member of Royal College of Physicians, and FRCS stands for Fellow of the Royal College of Surgeons. These are colleges in the United Kingdom where doctors go after a certain amount of training and after exams. They get this MRCP and they become members and they earn this degree of MRCP, MRCS. These are degrees which have earned through the United Kingdom.
Okay.
This is very brief. I've tried to simplify as much as possible. This is very much in brief about the medical degrees, and hope this helps. So next time, this is very important. Just like nowadays, one good thing which is happening is people have started reading food labels. They know what it is very important to read food labels to understand what food you are eating, how much of sugar is there, how much fats are there. It's very important. Similarly, before you step into any doctor's clinic, it is very important to know what is the qualification of your doctor and what system of medicine does he practice. Is he an allopathic practitioner, Ayurvedic practitioner? Everybody is equally good, but you should at least have once you're going, getting yourself treated, paying a consultation fee, it is very important to get to know what is the degree he is having and what is the system of medicine he is practicing. So hope this helps.